A familiar sight in Quebec these days. Public sector workers outside schools, hospitals, and clinics. Hundreds of thousands on strike as contract negotiations with the government stall. On Monday, 80,000 nurses will join for a planned 4-day strike.
That is absolutely the last option for nurses. But
this nursing professor and researcher says it sends a serious message to the government. At stake, salaries and working conditions.
A lot of nurses, before they even start working in the public healthcare system, already have an exit strategy in place. And that is not normal, that when you just begin a career, you're already unable to see yourself in that same career 10, 15, 20 years from now.
Quebec is grappling with an ongoing health crisis. Nearly half of new nurses are leaving the profession before they turn 35. More than 2 million people don't have a family doctor. So as workers strike,
alors la motion est adoptée.
In Quebec City, the government says it has the solution. A sweeping health reform bill creating a new oversight agency called Santé Québec. It'll be responsible for most of the decision-making in the healthcare system. The province says the reform will give patients quicker access to care, and it's also good for employees.
We have more mobility with our employees because they are not linked to one establishment. They are not linked to one installation. They could move to different installations. That's a big change.
But he says unions have to recognize the benefits of the reform and help along the way.
There's absolutely no consensus around this bill.
Unions disagree and say the mammoth reform was pushed through without due debate or an understanding of how it will really affect the system.
It was improvised. It's a very quick bill that is completely going to destabilize the healthcare system.
Sarah, with all this happening, what's the status of the negotiations with the nurses?
Well, after resoundingly rejecting the government's latest offer, Ian, 99% voted against it. The union has now presented a counter. So now it's in the government's hands. And if it rejects that offer, well, it's back to the negotiation table. But reform or not, nurses will be on the picket line tomorrow. Ian?
CBC's Sarah Levitt in Montreal.